Hi, everybody. Welcome to Crushing Doubts Q&A every Thursday at 5 p.m. Eastern, 2 p.m. Pacific. Let me just get my Instagram started and we can get going. There we go. Okay, we are live. Welcome to Crushing Doubts Q&A. As I said, every Thursday at 5 p.m. Eastern, 2 p.m. Pacific. I am here to answer your questions about mind-body symptoms. So let's start with what that's all about. What is a mind-body symptom? Well, when it comes down to it, as I'm going to explain over time, most of your symptoms are actually mind-body symptoms. And all that means is that it is about an interaction between your brain and your body. The vast majority of symptoms that you're going to have, even ones you go to the doctor for, are going to turn out to be mind-body symptoms. Now, it's not a mind-body symptom if you get hit by a truck and you break an arm. That is a purely structural issue. But most symptoms are not going to be. And let's talk about why I do this. I had 8 years of chronic everyday back pain. And I had no reason to believe I was going to get better. In fact, when I went to medical doctors, one of them told me that I probably would have this for the rest of my life. Well, boy, was she wrong. I don't have it. In fact, haven't had back pain since I was 36 years old, which is approaching 15 years ago. I play full court basketball twice a week. I don't have any of these issues. In fact, I haven't had a symptom that wasn't a mind-body issue, and I don't even know how long. I guess occasionally I'll have something like I had COVID. That wasn't mind-body, at least not purely. So my job here is to help you guys become certain about what's a mind-body issue and what's not. I can say that most of them are, and that's all well and good, and it's actually true. But ultimately, I've got to get you convinced of it. And of course, we have to make sure that there's medical clearance for me to say that. Now, we'll get into all of that about how do you evaluate these things. But the reason I do this Q&A is that as I was getting better, the thing that got me better was information. And I discovered the works of Dr. John Sarno, a brilliant medical doctor from the New York area. His book saved my life. And at the same time, when I started reading his books, I realized that I still had questions. And ultimately, Dr. Sarno said, you've got to accept the diagnosis to get better. Well, how do we accept the diagnosis that this is mind-body and not something structural? We have to believe it. And how do we believe it? We've got to get our questions answered. At least that's how I worked. So my goal here is to have you guys be able to ask all of your questions. There is no stupid question. And I'm going to answer them to show you what is a mind-body issue. Why can you get better from it? How can you get better from it? I'll say one last thing before we dive in. When I answer these questions, I'm answering them from the vantage point of the system that I developed in my own work to get better. And I call it the column system. It is based on the fact that when I first started working with people in this way, I would have them take a sheet of paper and divide it into 3 columns. And essentially, we're just organizing where these symptoms are coming from in 3 different ways: feelings, thinking, and your relationship with yourself. Now, you'll hear me call these columns the emotions column, which is about feelings, the doubt column, which is about thinking and getting to certainty, and the power column, which is about your relationship with yourself. And I have different ways of recognizing any kind of symptom presentation. How does it fit in a column sort of way, and what do you do? These are 3 columns where there's information in those columns. There's things that we do in those columns to get ourselves better. So as I answer these questions in relation to the columns, I want you to remember this is all a conversation. A mind-body recovery is all about information. And that information can come from a book. It can come from a discussion. It can come from looking at things within yourself. And one of the things I'm going to bring is the discussion. Ultimately, my goal here is not just to have you all get better from whatever mind-body symptoms you're having, to not have anything that's chronic or seemingly chronic, as I like to call it, and to be able to control your acute symptoms as well. There's a lot of relief you can get, and we're going to talk all about it. My ultimate goal, though, is not only to get you guys relief from that, but to change the entire conversation of this in our society. And the more people like you that I get to feeling better, the more conversations that people can have about what gets people better and why. All right. I see some people saying hello. Thank you for saying hi. I will do my best to acknowledge all of those, but I'm going to get to the questions first. We've got Karen here. Karen says, shitty, yucky day here in rainy New York. We got the same weather here in Cleveland. Woke up with a headache, bad dream, trying to figure out why. Sometimes it doesn't matter. My husband doing guy's weekend away. Part of me feeling needy. Want him to be let's see. Want him to be there's a misspelled word there. I don't know what it is, but probably wanting him to have a good time. Part of me happy to stay home, watch TV. I'm into him lately, and also had a thing with a coworker. I'm too old for work BS. Aren't we all? Too much to write about this, but it brings up bad shit from previous job of 36 years. All right. Oh, and then Karen then says, hope our fearless leader, Dan, feeling better. I am. I did have a cold from earlier this week. As I've often said, I rarely develop colds, and when I do, they're mind, body, and nature in a particular way. They come up when I've been really stressed. So I was for various reasons. I was at a funeral, a family funeral, so that was hard, but I'm doing just fine. And I'm really glad to be here with you all. All right, back to Karen's comments and questions. So as I was thinking about what you were saying, Karen, I want to illustrate something for you, but for the whole group. There is a flow to these columns. And I mentioned there's 3 columns, but the first thing you want to do is bring down doubt. Bring down doubt, then learn about emotions, then flow into power. So as I'm thinking about what Karen's saying, Karen, you've brought down doubt in large measure a long time ago. You worked with Dr. Sarno. You worked with Nicole Sachs. Now you're working with me. And we've all helped with different things. One of the things I've helped you with, though, is to see how important it is to bring down the doubt. We've done that. We've done that in large measure. I think you still have some doubts around the edges, especially around like, can you be powerful? Can you get rid of all these symptoms, and especially these emotional experiences? And you can. We're going to get into that. You've also learned a fair amount about emotions. In the emotions column, well, let me back up. In the doubt column, we work to identify the thoughts you're having that when they stay the same, keep the symptoms the same. If it's a mind-body symptom and you're having the same thoughts, it's going to be the same in the body. So we work to change that. And Karen and I have done that in large measure, some of it well before she even met me. Then there's the emotions column, where we find out about the emotional components that are happening in our unconscious experience that we don't know about. Because if we can become aware of them, we can take away acute onsets and upticks. So changing the thinking is what takes away the seemingly chronic. Understanding the feeling and becoming aware of it is what can take away the acute onsets and upticks. That's great. Then there's the power column. The power column helps us take away symptom plateaus and anything in our relationship with ourselves that just isn't feeling good. And Karen, we've been talking about this recently. You've brought down doubt. You've learned a lot about emotions. I think everything for you is flowing into power now. We're there. And that's actually good news, because you're on the third and final step. If we can get you into power, your symptoms are going to go down even further. Now, I did have a question in one of my groups today, and I'll get into some of the resources shortly that you can access to get yourself help with me. I had a question about why does it help from a symptom perspective to get into power? Just the basic idea. And here's the basic idea. The power column and being in power is all about whether you feel good within yourself. And think about it. If you're having a good day, your whole body feels better. But if you're having a really bad moment or a bad day, your whole body's not feeling it as good. A good example of that is, let's say you're feeling really guilty about something. Feeling guilty is no fun, but it also affects your body. Your whole body's tense. Or maybe you're feeling overtaxed by your work and you feel like, I'm never going to get everything done. Your whole body can start to feel tense. You can stop breathing deeply. Everything gets tense. So, Karen, I think one of the missing pieces for you is to get you into full power. And as you're describing this, some of what I'm understanding is when your husband is away and you're feeling needy, that can make you feel out of power. Or remembering this work BS, it can make you feel out of power. So what I want to do is to start working on how do we get you into power. So I often say this, but the emotions and power columns are both emotional columns. The emotions column is where we gain awareness. And the power column is where we understand its broader context within ourselves and make adjustments. I think that's where you're at here, Karen. We need to understand what's happening with your power and make some adjustments. That way, you can enjoy staying at home and watching TV. You can feel good in you instead of feeling like there's something missing. Now, how do we do that? We would need to explore what's lowering your power. We need to understand it because if we can see what's causing it, then we can make adjustments. I'll leave it there for now, Karen, but let's do follow up as needed. Or if anybody else has questions about it, please do ask. But ultimately, we want you feeling good in all three areas. We want your thinking to not have a lot of doubt in it, feel really good about where you're going. We want your feelings to be things you're totally aware of or a lot more aware of or can access so that you can control symptoms. And then we want you feeling good about your interactions with yourself. All right, I see some new people here today. Great to see some new people. Here's one. Blessed Mama. She says, "What do I do when symptoms are super loud? Very hot pelvic nerve." Okay, let's talk about the things that make symptoms really intense. There are two main things that make symptoms super intense or super loud, as Blessed Mama's putting it. I like that way of putting it because they're just like they're really in your face. They're really powerful and active. When that happens, it's because of one or two things, as I mentioned. One is in the emotions column. If you're not aware of a really tough emotion, it can lead to a very, very strong onset or uptick of the symptoms. Now, I have a gut instinct based on what you're saying, though, that that's actually not likely to be the main thing here. What's more likely to be the main thing based on what you're saying is that if you're having a symptom that's pretty consistently there, but it goes way up at a certain point, that's because of a certain form of doubt that I call fear. Everybody knows what fear is, but I want to go over what the forms of doubt are. They're fear, confusion, lack of certainty, and unanswered questions. And if you think about the four that I just said, you can probably hear which ones are the worst. Fear is the worst. You can barely even think. It's terrifying. But once you're past that, you're into just confusion. Confusion is not fun, but it's not nearly as bad as fear. However, fear and confusion, I call the negative side of doubt. They don't help. They make things feel worse and worse. And the positive side of doubt is lack of certainty and unanswered questions, because those are doubts that if you voice them and you look at them, they're designed to get you help. If you get answers to those questions, it's going to help. If you resolve that uncertainty, it's going to help. Whereas if you bring down fear and confusion, yes, that's going to help, but mostly in terms of taking away a negative. Back to Blessed Mama's question. What do I do when symptoms are super loud? You need to identify why. And these are the two possible sources. Either there's a very big emotion that you're not aware of, and the way that's going to present is a sudden onset or uptick, where the symptom either wasn't there before or it was pretty low and then suddenly it's super high. If that's the case, yes, we want to look for an emotion, and it would be an unconscious emotion. And in the emotions column, I can help you do that. I help people develop what's called an emotional themes menu, where they create a list of all the things they hate most in emotional experience. And then you could look down that list and be like, what happened that fits with the timing of this symptom? So that's if you see a big onset or uptick. But if this is a symptom that's pretty consistently there, and now it's gone way up, I'm going to want you to look at fear. We want to identify what the fear is, and we want to calm down that fear. A lot of what I do calms fears because most fear isn't even about having a symptom. It's more about believing you have a symptom that you're never going to get rid of, or you can't control, or you don't know what to do about it, right? Blessed Mama had a follow-up. She said, fear is super strong, especially when symptoms are loud. Yes. And it can cycle in on itself. You can have fear that raises the symptom, and then raising the symptom raises the fear, and then that raises the symptom more. And so it can go on and on. Now, Blessed Mama then says, I have journaled and can't connect to emotion needed released. It was an abdominal hysterectomy that did it. So this is all pointing to the doubt column. when I answer these questions, guys, one of the things I'm trying to assess is which of these 3 columns is the driving factor right now. What Blessed Mama is describing is something that I call beating your head against the emotional brick wall. I don't mean that as a negative about anything she's doing or even about what people are recommending. But if you are just continuing to try to get at the emotion and really what you're having is fear, you're not going to get at the emotion because fear is the problem. So we need to reduce that fear, which is a form of doubt. How do we do that? In the doubt column, I have steps: observe, articulate, and counter. So I want you observing is just simply noting this is a doubt. And you're already doing that. You're like, yeah, this is fear. So you're already doing observing. Next thing is to articulate it. Let's get it put into words. What are you afraid? What are you afraid of? What are you afraid happened with that hysterectomy? What are you afraid it'll lead to? Let's get those put into words. So instead of journaling about feeling, if you're going to journal about doubt. What are you worried about? Let's get that targeted. Once you hear it stated, then we can counter it. All right, Blessed Mama, let's see how that helps you. But one of the things I want to highlight here is what we just did shows you why these columns work, because you have to know what to do and when. A lot of mind body work tells you do this, but they don't tell you when or why, and they don't tell you what to do if that doesn't work. And I'm not saying that critically of anybody who's saying these things. It's just an added advantage of the column system that shows you that you actually have different moments at different times. If Blessed Mama is going to keep working on the emotion when it's really about fear, then it's not addressing the need. And I'm always going to be good at helping people understand how do you shift that. Okay? Blessed Mama, tell me if that's helpful for you or what else you need. All right? I'm going to jump back over to YouTube with a question from Hillel. Hillel says, I've been thinking about what we talked about today. I spoke to him earlier today, and I really think that's the right direction. I completely agree. I think we were right on course, and a lot of that was because of you. There's someone I want to get to know, but I'm torn. Okay, so Hillel and I were talking about, oh, hold on. There's actually much more you're saying here. On the one hand, I'm afraid to miss the opportunity. And on the other, I know my body will go crazy with symptoms, and I honestly don't know what to do. She was the reason I even talked to you about the whole thing. Otherwise, it would have stayed tucked away in a drawer for a long time. All right, so I'm going to say a couple things. This is for Hillel, but it's for everybody who's listening. Your body is expressing things. You know, a lot of times we see these symptoms and we just think, I just wish they would go away. Just leave me alone. But ultimately, we're going to do better if we recognize that the body is saying something important. And so, Hillel, I actually think it's a great thing that your body's talking right now. And that way, instead of putting it away in a drawer for a long time where it would be sitting there and have to be brought out and dealt with, we're going to deal with it now. And I understand it can feel scary, but we're better off dealing with problems now because then we won't have to deal with them later. We're actually going to resolve problems. So Hillel and I were talking earlier today about vulnerability. That was really the primary word. And vulnerability is something that a lot of times people think like, oh, yeah, I can be vulnerable. But similar to what Hillel and I talked about today, a lot of times when you really look at it, we're not being as vulnerable as we think. We might be telling people what's going on, but that doesn't mean we're just laying it out there, just being in it. And Hillel, you're talking about a dating situation, it sounds like, and you want to talk to her, but you're scared. And so, pardon me, because of this cold, I've got a little bit of a cough. What we need to do, Hillel, is keep working on the vulnerability piece. And guess what? Good news. You do not have to resolve everything to do this. It can help to do that. Certainly, we can resolve as much of this as possible to get you to a place where you realize, yeah, this is about authenticity and about vulnerability, not masking what's going on for myself and just being fully me. We can work on that from a cognitive standpoint when we're thinking about the columns and what's involved. We can think about it from a body standpoint in terms of calming your body down to be able to be in that moment. And then there's another way we can do it. And to me, this is a power column intervention. It's where we basically say to ourselves, I don't care anymore. I'm not going to make choices that limit me anymore. I'm going to go ahead and talk to this girl, even if it is, terrifying. And that's what happened when I met my wife. I was terrified to talk to her, and I decided I'm sick of this. I'm tired of not being. I didn't know the phrase power then. I hadn't created that in my mind as to how it related to the columns or any of it. I didn't even have back pain at the time. But I decided I was tired of being scared. Just tired of being scared. And so, Hillel, many ways we can do this, and we'll really do all of them. But we are going to help you understand why you haven't wanted to be vulnerable, why it's so scary. And yet, ultimately, I think a huge part of this is for you to just decide you're going to do it anyway. Now, we'll talk more about what all of that entails, how you can deal with it. And but the body's telling us something big's happening here. And whether this girl's, going to be the one for you or it's going to work out or not isn't even what matters. What matters most, I have found, is to have these columns under control, have the doubt nice and low, have the emotional awareness you need, and be in power with yourself, having a good interaction with yourself. If that happens, something good's going to happen, whether with this or not. Okay, let's do follow-up as needed. Shelby Geyer, good to see you here. She says, hi, Dan and CD fam, crushing down family. As the day goes on, symptoms seem to increase some. Why? Okay, so listen, everybody's symptoms behave differently, potentially, because we have different minds. So it depends on what you're feeling, what you're thinking, and what your relationship with yourself is like. But this sounds like mainly a doubt column issue. And the reason I say that is you've come to expect this. It's what happens. So listen, it could be that your emotions, some emotional experience increases as the day goes by, but I'm doubting that's the case, to use my phrase. I think what's much more likely is that your thinking changes as the day goes. Sometimes people think, well, I just can't hold off the symptoms for that long. If I'm, having to deal with it longer, there's more chance that it'll happen. Sometimes people have what's called a conditioned response, which is I just expect that it's going to get worse at that point. In that case, you need to challenge that conditioned response, or what I call a doubt trigger, and say to yourself, no, it's not inherently true that the symptoms are going to increase. I need to challenge that and show myself that I can get more control over it. Part of the reason I say this, Shelby, that this is likely to be the case for you is I know how your mind works from things you've told me, where even when you get into a good mindset, you don't expect it to last. And that's what's happening here. It's not lasting. So as the day goes on and symptoms seem to increase some, why? It's because your doubt's going up in one form or another. Could be fear, could be confusion, could be lack of certainty, could even be an unanswered question, but something's going on where you don't feel like you can expect a more positive outcome throughout the day. Whereas, when we get doubt nice and low, pardon me, one of the things that can happen is you come to expect things to be better. When I think about my own bodily experience, I don't expect to have many symptoms. Sure, I have some symptoms right now because of a cold. But even that, right now, this cough, that's not even related to my cold. This is a mind-body symptom right here. I don't even know why. It probably goes back to, let's see, when did it start to come on? I don't know. I'd have to sort it out. But this is an emotions column, onset and uptick. And it's just taking advantage of the fact that I have a cold. That's why it goes there. So it's probably about me feeling confident about my symptoms. What I was about to say, that is when I started coughing, which is pretty funny to me, is that I was going to say to you, Shelby, I have such confidence. Yeah, it's giving me a throat tickle as I say this. So that's definitely what it is. I have such confidence that I can control my symptoms. And I really do. But when I say these things, it's about what I'm saying, right? Actually, Scotty Styles, good to see you here. He said, tickle in the throat. This always happens to me when I want to speak during a cold. So symptoms are going to pounce, and there's more pressure to perform. So symptoms are going to pounce where they can. And I'm saying something where I'm saying, hey, I'm confident. And it's basically saying, oh, are you? Well, I'm going to give you a little throat tickle to maybe make it seem like you're not as good at this. That's the kind of thing that your mind will do. I'm not afraid of it. And actually, I'm not even afraid to tell you guys the process because it's helpful for you. And if you notice, that symptom went away. How did it go away? I got extra confident. I basically got in there and I said, doubt, you're not doing this to me. No, I'm not worried about this at all. I can make symptoms go away. I'm very good at what I do. I returned myself to power. I brought the doubt down, and power and doubt have an inverse relationship with each other. And lo and behold, symptom gone. All right. Now, back to you, Shelby. Your question is really about doubt. Your doubt goes up at various points. Most of your symptoms are driven by doubt. So I'll remind you guys of the flow of the columns. Bring down doubt, learn about emotions, flow into power. Shelby, you're still in that. I don't mean still like this is a bad thing, but it's just at the beginning of the work or when you haven't made enough progress, you still have doubt very high. And we want to bring that doubt down. For me, my doubt's super low. So it was unlikely to be there. An emotions column onset, yeah, but actually that was mostly power related. It was me saying, I'm good at this. And then my throat was like, I can pounce on you a little bit here. I recognized it and I brought the symptom right down. Okay, Shelby, I hope that makes sense. Shelby then said, you had a cold around your book published date too. Crazy. Yeah, no, I'm telling you, I never get a cold unless I'm stressed. Ever. Like, which is really interesting. So what does it mean? One way we could think about it is what that means is that the immune system gets lowered when we're stressed. So then we're more likely to have germs come in. Germs are everywhere. A cold is out there all the time. But somebody could sneeze right in your eyes or your mouth. A little bit gross, but hey, if you're not stressed, your immune system will just fight it right off. If you are stressed, the immune system is lower, those germs go in. So yeah, Shelby, we can keep tracking this. You guys will see. I get a cold virtually only around stressful events. Very interesting. Around abbreviated was what you were saying before. So let's jump back to that. So you want him to be around, but part of you is happy to stay home and watch TV. Okay, absolutely, Karen. But we need to get you to a place where you feel really in power. I see you have some comments below, and I'm going to get to those in a second. Okay. All right. Let's see. Shelby then said, so what if thoughts change, but symptoms don't? Okay. It depends on how much your thoughts change, Shelby. Bringing down doubt some isn't usually enough to get the symptoms to change. What we need is to get full confidence. So I have this thing that I call the fear confidence spectrum. And it basically moves you through those higher forms of doubt. It gets you out of fear, and then we move into just confusion. And then we get you less confused, and we move into lack of certainty. Now we're into the positive side of doubt where we can start making gains. This is where thoughts changing can actually change the symptoms. So when you say, so what if thoughts change but symptoms don't? I don't mean this is bad news, Shelby. I'm just locating it. You're still in the negative form of doubt, the negative side of doubt, fear and confusion. If you bring those down and your thoughts are changing, good. You're on a good path. But you're not far enough over yet to get the symptoms to really change. The symptoms will start to change when doubt starts coming down, and that happens when you're in the positive side of doubt. When you're in the negative side of doubt, it doesn't change all that much. Shelby, let me know if that made sense to you. I do want to say this. When I answer a question, it's got to make sense to you. Doesn't matter what I'm thinking. These are mind-body symptoms. They come from what's going on in your mind. Okay. Jumping back to Instagram, Blessed Mama had a follow-up. Labeled as pudendal neuralgia. I even had nerve decompression surgery, still in pain. So I'm sorry you've been having these, but good news. If we bring down your doubt, there is nothing that's seemingly chronic or supposedly chronic that will last. Nothing. It's similar to what I was saying to Shelby. When we get you out of fear, we get you out of confusion, then we can start to bring down the doubt in more positive ways and get you relief. You're not stuck with anything. The only things that you're stuck with are things that are purely structural. Like if you had to have an amputation, you can't get that limb back. And in fact, you might have phantom limb pain from something like that, but you're not stuck with that either. Generally speaking, you guys aren't stuck with pain at all. The things we're stuck with are things that are very purely structural, like an amputation. I'm not even talking about like herniated discs or arthritis. Those are not structural things that cause pain. Even limited mobility, that can be worked on. The only things we're really stuck with are structural damage that cannot be reversed. Like my wife's a type 1 diabetic. Her pancreas is damaged, does not create insulin. So for now, she's stuck with that diabetic condition. We're stuck with things like mortality. We are human beings. Everybody's going to die. We are stuck with certain things, but we're not stuck with most things, especially in life. So I want to work with you on this, blessed mama. Let me actually talk about some of the resources available on my website. It's a good time to do it. So I have had to build systems for a long time here to get people to a place where they had the resources they needed. My book is included in that. My book is available on Amazon. It's called Crushing Doubt. It is the most comprehensive resource that I could possibly have created. It has every main thought that I needed to share with you guys about what leads to doubt, why we can be clear about mind-body symptoms, and why they're so rampant, what to do about them. It builds out my system. So, and kind of what to be thinking when. So if you need a guide taking you through these things, especially a cost-effective one, my book is the way to go. It's on Amazon. By the way, if you've read the book and it helped you, please, please, please consider leaving a review on Amazon. It really helps more people discover the book because they see, oh, a lot of people have read this, think it's good. If you wanted to work with me directly, though, obviously there's these Q&As, but I have these group memberships, or a group membership, and they're group sessions. They're Mondays from 1 to 3 p.m. Eastern, Tuesdays from 10 a.m. to 12 p.m. Eastern, and Wednesdays from 5 p.m. to 7 p.m. Eastern. I left them I put them at different times so the different time zones and different parts of the world could work with me, because these are Zoom calls and they're international. I help people all over the world with these things. And even better, they're just $100 a month to meet 3 times a week for 2-hour meetings, sometimes even more. We're talking over 24 hours of time with me every month for just $100. You also can write written questions on the community site, and I get back to you usually within 24 hours. I'm a little behind right now because I was out earlier in the week. But these are great resources to have. And I built them for you guys. I everything I do, I think about what did I wish was there. So the book I wished was there. These groups, I wish they were there as well. Check out my other resources. It's on www.crushingdoubt.com. But those are 2 of the main ways in a cost-effective way that you can get better working with me. Okay? Lots of ways to do it, but check it out and let me know what you need. Jody Lynn, good to see you here. But what if you have fear and doubt not connected to a physical problem, but to a situation like fear of social situations or fear of driving? Okay, that's a different form of doubt, but it's still a symptom. Everything's a symptom. So we can still bring that down. What we would do is the same as with the other doubts. We would observe, articulate, and counter to look at what's happening. Observe is to call it into question. So if you think, well, I'm having this fear of a social situation and it's never going to go away, you're not calling that into question. You're buying into it as a fact. Instead, I want you to say, okay, this is a fear. Maybe I can get this better. I need to look at it. That's observing. Call it into question. Then get it articulated. What are you afraid of here and why? What's the fear about? Get it put into words, and then we can take a look at it. So, Jody, even if it is about something psychological, it's still a symptom, still something that we can get articulated, observe, articulate, and counter. And countering is bringing in new thinking to get to a place where you can feel better about it. So let's say you're afraid of a social situation and you're like, actually, Hillel's example was a good one, feeling like, oh, I can't do that. Well, actually, why not? Let's say it's because, oh, if I got embarrassed, I wouldn't be able to tolerate it. We can call that into question. We can counter that. We can say, no, actually, you could, because the worst part, as an example, I'm making this up, but the worst part might be what you say to yourself, how you attack yourself, what doesn't feel good in your interactions with yourself. Well, if that's the case, you've got more control of this than you think. So first step is observe. Call it into question. Wonder. Does this need to stay this way? Second step, articulate, get it put into words. What are you afraid of? Then we can work on countering it. All right, let's see where that goes from there. Okay, Scotty Styles had a follow up. Confidence is power. I like it put this way. And confidence is genuine optimism, which is the opposite of doubt. I couldn't say it better myself, Scotty. Thank you for sharing those thoughts. Power comes in many different forms. And if we think about it, power is feeling good with the self. So that can come in many different wordings. Confidence is one of them. Feeling confident, genuinely confident, that feels good. That's powerful. Okay. I do see some new people on the site. Mind Body Joy Community. Thank you for joining us here. I think I know who that is, but I actually lose track of if the name is something else, then I don't always know who it is, but I think I do know who that is. So saying hi. Let's see. By the way, if I missed any questions on here, please do let me know. All right. Blessed Mama says scared because keep thinking it's structural. All right. Well, we can look at why do you think this is structural? What did they say to you about it? Right. And I can show you studies that show not likely to be true. I can show you studies about other parts of the body that make it seem like, well, why would it be true in this one part, but not in others? If we're good scientists, what you're going to find out is that this is all mind body. You can cure it all. It's about changing your thinking, understanding your feeling, and changing your relationship with yourself. Those three areas are going to get it done. So when you say you're scared because you keep thinking it's structural, well, tell me what they said to you. What do you think is the structural thing? What are you envisioning in your own mind about it? Right? Let's get these articulated because we can do something with it. Okay, Jody Lynn says that's the perfect example. Thanks, Dan. You are welcome, Jody. I'm glad that helps. Okay, Karen, let's have a follow-up here. When they stay the same, symptoms stay the same. That's about thinking. That's a good one. Yes, symptoms have been the same. This will be something we work on. Thanks. Absolutely. And then Karen says, yes, flowing into power. Exactly. So we've got a little bit of lowering doubt here where the thinking's staying the same, but it's probably related to power more than anything else. There's different ways that you can have your thinking stay in the same place. It can be about, is it mind body or not? It can be, is my mind body symptom harder to, manage than others? Or it could be, oh, sorry, I just saw, I'll say that in a second. It also could be about doubts about the self. All right. So these are all ways that we can look at our thinking and make changes. All right, Sarah Manis, thank you for the tip. Sarah gave a super sticker. It's something that you can give if you appreciate what's going on here. It's very helpful because actually a lot of the time I'm running at a deficit. People don't often know that, but mind body work, we need to make it cost effective. We need to make it affordable because a lot of times people are having symptoms and they can't work or they can't afford too much. So thank you so much, Sarah. And I'm going to jump to your question as a thank you for that tip. Okay. Sarah says, hi, Dan and Crushing Doubt family. I've had much less fear due to doubt lowering. Great. Glad to hear it. Last week, everyone's encouraging comments helped me to really believe my tinnitus is TMS. That's what Sarno called mind-body symptoms, tension myositis syndrome. As a result, the sound has been lower in volume, and there have been hours every day that I don't hear it. It's fading away. That's amazing. Also, she says, sorry for the typo. It was supposed to say doubt, not doing, but I caught that. Look at what's happening here, guys. Just by lowering her doubt, the thinking changed. It changed her relationship to the tinnitus, and it changed the symptom. That's exactly what happens. But jumping back to Shelby's question, when she said, well, what happens if your thoughts change, but your symptoms don't? The difference between what Shelby's saying and what Sarah's saying shows you that spectrum of doubt. Sarah, you are in what I call the positive side of doubt. You're just getting more certain. You're getting questions answered. That's going to move you towards greater certainty. It's not just about lowering doubt. It's about getting to certainty. Sarah's getting more certainty, and it is starting to break up those symptoms a lot. Shelby, you're not quite there yet, but you're still making good gains. The thoughts are starting to change. It's going to move you into that positive side of doubt. All right. Thank you for saying that, Sarah. Beautiful news. Wonderful to hear. I'm here to help as needed, but sometimes that's all it takes. Get into certainty and it goes away. That's what happened to me with my back pain. I started looking at it. It started to make more sense. 3 days before my back pain went away, things really, really, really started to click. And then the symptoms just vanished. It's pretty great. Then I was doing flips in the pool 3 days later. You're on your way, and I'm looking forward to hearing more about that, Sarah. Great. Russell Crane's music. Good to see you here. Hi, Dana and Crushing Out community. So, wondering your take on why I have physical symptoms when I become angry. Does my mind register the anger as dangerous and necessitating a trigger? So, this is my first answer to that question, Russell. We'll do follow up as needed. So it can be a couple of different things when that happens, but clearly the symptoms are related to the anger in some way. My guess is that it is an emotions column trigger where, yes, that anger is attended or comes along with another feeling. You're aware of the anger, but you're not aware of whether it's dangerous or maybe an aspect of the anger. Something's going on that's making that feeling lead to a trigger. If it's an emotions column thing, it's something you're not aware of. And the physical symptom is needing to distract from it. However, it can go up for other reasons too. If you register the anger as dangerous, that's a fear. And that's doubt. And so doubt, I think, is probably coming in here on top of it. Given that you're aware of a feeling and then maybe it's dangerous, this is actually probably more of a doubt-related thing than it is emotions. And yet, it also could be power. So here's what I want to say about the columns. Always check out all three if you can. First things first, bring down the doubt, then learn about emotions, flow into power. But check all three columns because this also could be about power. This could be about the fact that you becoming angry is affording you a chance potentially to move into power. It's reminding me of what I was talking about with Hillel. When you have a chance to move into power, it can feel scary. So assess all three columns, Russell. Let's figure it out. If I had to guess based on what you're saying, I think that being angry is starting to move towards power. It's starting to feel dangerous, and then doubt goes up. So in a way, you've got all three columns active right here, but primarily doubt and power because you've got a lot of emotional awareness going on. And yet, check to see if there's something even more specific in that emotions column. All right. Susan Sereno, good to see you here. If you fear the symptoms or a particular symptom that is persistent, is that doubt even if you know it's TMS? Yes, it is doubt, even if you know it's TMS, because what it's saying is my doubt isn't about whether it's mind, body or not. My doubt is about, this is interesting. Every time I'm having this tickle, it's about power. So that's about mine. But I think, Susan, this is about power for you as well. The kind of doubt that you're having is this reversible? Can I do it? It's really about stepping into personal power now. So you're saying, if I'm not doubting it's structural, where is the doubt? The doubt is about, is it reversible? And can I do it? So that's what I'd be looking at, Susan. Well, let's go from there. Well, that's the short answer, but we can get into longer answers. By the way, I want to say this. If people join my groups, one of the great advantages is we get further in one sitting. What I just said to Susan is very useful, but if we were in group, she could ask me questions. Wait, what did you mean by that? And I could say, hold on, how are the symptoms behaving? We can get a much more precise answer in group because of that. And in addition, you're getting all of those interactions again and again. It's not just when you're asking questions. But Susan, yes, you can have doubt even when you know it's TMS. Okay. Blessed Mama has a follow-up. Surgeon stated she has a panic and anxiety attack during surgery and had her aides step in, and she was tugged away. Oh, she tugged away at my cervix, but it's adhered to the bladder due to the fact that it got cut. Scar tissue is nerve damaged. Symptoms are burning. Okay. Oh, can you please post this live? I have an appointment here soon, but would love to hear your thoughts and tips on this. So I actually do post this afterwards on Instagram, on YouTube, on Facebook. You can just check it out then, but I will give my answer to this. I see why you have a lot of fear here. There's information here that scared the crap out of you. Scar tissue, though, does not cause pain and other symptoms. It doesn't at all. Scars work the same on the outside of the body as they do on the inside. They don't cause pain. In fact, they have less pain there. Nerve damage, that's extremely unlikely to be the case in any way. But here's something that would go differently in group. I'd be able to ask you questions. Wait, what happened? When did it happen? So I'd do more of an assessment. However, I'm certain this is mind body. Just based on the way that you're presenting, the way you're telling me this story, and the fact that mind body symptoms usually explain almost everything that we're going to get in these symptom experiences. So let's talk more about it. But essentially, what's happening here is you have very plausible but incorrect reasons for doubting, and ultimately, I'd need to get you convinced of that. If you haven't bought my book yet, Blessed Mama, I highly recommend it. It's going to show you why you don't need to worry about scar tissue. You don't need to worry about nerve damage. What you have here is fear. And if I can help you know that, then you're on your way. All right, we'll keep at it. Jill Rotto, good to see you here. Hi, Dan. My sensations of PPPD are hard to deal with, especially when I rock and sway a lot of the time when I'm standing still. How do I change my mindset toward these symptoms as my anxiety goes up? I know it's the fear. All right, let me see if you have more on that. It's definitely the fear, but here's the way that I would think about it. First, you got to bring down doubt enough to be able to do the work. If you can't bring down the doubt, you can't see what's underneath. But I think you're already basically doing that work. You know it's the fear, so you're observing it. And sure, your anxiety goes up. But what I want you to do is to start thinking about the next step. Bring down doubt first, then learn about emotions, then flow into power. So let's talk about the learning about emotions aspect. I think what I want to help you see is that when these symptoms change, because I'm assuming they do, I'm assuming you do not have these things all the time or in the same way all the time, even if you do have it consistently. I want you to start to see the onsets of them or the uptick of them as relating to emotion. So we would start looking at, well, what are the kinds of things in your emotional world that could lead to a symptom? And ultimately, that's the main recommendation I can make for you, Jill, is start thinking emotionally about these symptoms. Start thinking about what's going on in your emotional life, and it'll make you less afraid of the symptoms because you'll have something to do. Not only that, you'll have something effective to do. You want to get to a point where you can recognize what's happening here emotionally. That's the step you're on now, Jill. If assuming that your doubt is low enough to look at that, that's what I want to do. If it's not low enough, then I'd back up and go back to the doubt column and bring down confusion or maybe fear until you can look at the emotional side. But ultimately, when you see there is a link between the emotions and these symptoms, that's actually going to bring your doubt down the most of anything. Whoa, these really do relate. All right, back to Blessed Mama. Symptoms are burning private area. Yeah, very, very common experience, unfortunately, but fortunately, totally curable. We can get rid of this. First thing to do is we're going to need to bring down that doubt with information. Then I'm going to get you to be able to see those symptoms shifting, and that's when you're going to be able to see emotional experience and how it relates. That's going to bring down your fear even more and your other doubts even more, and then we'll move you into power. I highly recommend my book or coming to see me in the groups. I do have seminars also that teach all about this. So there's lots of ways to learn about this. Get the information. All right. I'm giving you a recommendation about that. I hope that you go right into that if you haven't already. If you have, then we'll talk about next steps. Okay. All right. Shelby Geyer says, yes, you know my mind like you can read it. I think lack of certainty is what it is. Thanks as always, Dan. Yes. We are moving you along the spectrum of doubt. We want to move you out of fear and out of confusion and into the positive side of doubt. When that happens, Shelby, we are starting to get off to the races, and I cannot wait for that. Actually, I'm going to answer this one question about group first. Tusif K says, what happens in group calls, please? So these are Zoom calls. They are recorded, and people ask questions just like here, but I get much deeper into the question. I ask questions about, wait, what? Okay, why do you want to know about this? What is it you're wanting to know? What aspects are you struggling with? And so my answers are much more precise. They're much more advanced. And meanwhile, you're watching this happen again and again. So over and over, everybody's questions, I'm relating it back to the columns. Essentially, what's happening is I'm teaching how to use the columns. I'm teaching the system again and again with you and with other people. In addition to that, we also share wins. It's a great part of the group. People talk about the gains that they've made in symptom reduction, in their thoughts changing, in their optimism going up, in an insight they got. And it's a very encouraging way to learn the system and be able to implement it. So that's the short answer, Tusif, but let's follow up as needed. All right, Patty Flowers, good to see you here. My symptoms don't make sense. Let's pause here for a sec before I even read on. I mean, this is good news, Patty. I have a rule of thumb. You make sense and your symptoms make sense. I'm not at all criticizing you for saying my symptoms don't make sense. A lot of people say that, but my goal is to make sense of them, and we're going to. Now, I'll jump back in on what you're saying. Neuropathy in the form of allodynia. I think that's sensitivity to sensitive skin, but I sometimes need to look up the terms again. They're all the same. It's all mind body, but constant neuropathy pain. It sounds very uncomfortable, and I'm sorry. I've been there myself. Don't have flares like other people, just constant pain, so I don't know what column I belong to. Constant pain is the doubt column, Patty. You don't need to look any further than that. The emotions column leads to these onsets and upticks. Things are changing a lot. When things are not changing, it's the doubt column. A lot of times people come to me and they feel that that they're different than other people. No, you're not. There's a lot of people in the mind-body world who are having symptoms that are having them just like you. Constant. My back pain was pretty much constant. When I say pretty much, I should say this. There was no time that I didn't have back pain. None. There was no time where I didn't have back pain that was pretty high level. It could sometimes vary in between medium and high, and that was it. And a lot of times it didn't vary at all. So this is a very common experience, Patty. It is the doubt column. We got to get you to understand that this isn't structural. Got to get you to understand how you can get better and bring down that fear. Okay. One or two more questions, then we'll wrap up for today. Susan Serena says, please talk about how doctors and the medical community perpetuate doubt through nocebos. Okay, so nocebos are about negative beliefs that cause symptoms. A placebo is a positive symptom result, some kind of change in your physicality from positive beliefs. A nocebo is the opposite. Negative symptoms come up from negative beliefs. Doctors in the medical community, as good as they are with certain things, they are saving us from all kinds of life-threatening issues. They're working very hard in general to help us with these things. There's a lot that I appreciate about the medical community. But when it comes to symptoms that are persistent but not dangerous, or acute and recurring, they don't seem to know what they're doing very much. And as a result, they're giving us lots of information that is incorrect. And without meaning to, at least I would think most of them don't mean to, they're scaring the crap out of all of us. They're telling us that our bodies break down. They're saying things like, as we age, you're just going to have more and more pain. That's not true. It doesn't even bear out in what we actually see. If it did, 90-year-olds would be in the most pain of anybody. And that's not what happens. So they're saying all kinds of things. They're saying, oh, you've got to maintain your posture. Or if you don't sleep enough, then this is a problem. They're scaring us right and left. They're trying to be helpful, but it's not helpful, especially when it's not true. And most of what they're saying in these ways are not true. So they are perpetuating doubt all over the place. And really, then we're doing it with each other because we got this information and then we pass it on. That's perpetuating doubt everywhere we go. That is a great question, Susan, one I'd like to answer in more detail, but we'll have to do it more next time. But bring it up again. This is a great topic. Hopefully I answered it well enough. Last question. Ani Crowfoot says, technical question. Your cough is about power, you said, but that is not a plateau symptom. Can you explain? Then she says, I know I'm being very literal. All right. So, one of the difficulties in explaining the column system is they have many different functions at once. And yet, if you understand them, it can develop into a very simple way of looking at it. So what she's asking about is essentially this. The way symptoms present tells you something about the column. It tells you if it's an onset or an uptick, that's emotions column. If it's seemingly chronic or very persistent, that's doubt. Just like I was saying to Patty. I think that was Patty, right? Yeah. If it is a plateau where you've gotten better to a certain point, but you're not breaking through, that's a power column issue. However, that's only one of the reasons that you can have a power column symptom. So power column symptoms are not always going to be plateaus. If it is a plateau, it's power. That's a rule of thumb. But you can have symptoms for other reasons. So you can have doubt even when you're not having a seemingly chronic symptom. You can have an emotions column symptom when you're aware of an emotion, but not the specifics. There's subtleties and nuances to these things. So what Ani's asking about is, if it's not a plateau symptom, how can it be power? Well, it's because when you're out of power, you can have symptoms, whether it's a plateau or not. A plateau is simply a way of recognizing a clear power column symptom. If you're having a plateau, it's power every time. But the reverse is not true. It's not true that every time you have a power column symptom, it's a plateau. It's not. Here's another way of thinking about it that may make it even clearer, Ani. Technically, that was an emotions column symptom. It was an onset or an uptick. But the topic of that emotions column symptom was power. I really like the way I said that, actually. That hopefully will answer your question perfectly. But what I said about the plateaus is also true. Okay. Shelby Geyer says, thanks, Dan. Get better. Thank you. I'm sure I'll be better soon. I feel better today than I did yesterday, and it's heading in the right direction. Russell Crane's Music then says, not sure if it's too late for a second question. I'll get it in a speed round question. Lately, I've been trying to improve my posture for purely aesthetic reasons. A lot of ensuing pain as a result. Is the pain purely doubt? Yes. It's okay to try to improve your posture for aesthetic reasons, but I always say, do the thing that lowers the doubt. In this case, you're doing a thing that's raising the doubt. And now what I'd like you to do is, you can still do it, by the way, but do it in a way that lowers your doubt or doesn't mess with your doubt. Say to yourself, I'm only doing this for aesthetic reasons. It is not going to do anything in relation to pain. The only thing it might do is raise or lower doubt. If it lowers doubt, good. If it raises doubt, bad. But is the pain purely doubt? Yes. Because all we have to do is look at the timing of the symptom to see what's the cause here, right? And in this case, you are making a change that you had some doubt about in the past. And posture, like what Susan and I were talking about, it's another one of these nocebos that people talk about. I think it's better to slouch and feel confident than to get into a good posture and worry that it might be what's causing the pain or might be what gets you better. Decouple it as best you can. Russell, I hope that makes sense. Okay, Ani says, wow, I got it. Excellent. So I just to sum that up, the primary thing was that was an emotions column symptom about power. And power column symptoms are not always about plateaus, but plateaus are always about power column symptoms. That's the best way of summing it up. I saw lots of new names here. I'm excited to talk to all of you about it. Maybe I'll start announcing some of those names, just to say hi. But I really want to encourage you. You all can get better. I've got the resources for it. Go to my website, www.crushingdoubt.com, or get my book on Amazon. And please leave a review if you ended up liking the book. These are the best ways that you can get answers. And ultimately, that's what you need. If you don't get answers, you keep thinking the same things and the symptoms stay the same. But information is the key, and I will get it for you. All right, guys, we'll be here same time next week, 5 p.m. Eastern, 2 p.m. Pacific on Thursdays. And I look forward to continuing the work with you. Come see me in group as needed. Get my book. Keep asking your questions. That's the main thing. You got to get your answers. Okay, guys, thanks so much.